breast cancer patients are first diagnosed, one of the first questions that they ask their oncologist is, should I change my diet? What we want is a lot more research on nutrition, and so that can debunk some of the myths that we get on the internet. There's an awful lot out there that will tell you you should be eating all kinds of weird stuff. And we want to know what's the science behind all of that. This program has the potential to personalise treatment for patients going forward and perhaps keep patients on chemotherapy with a dose reduction or monitor them more closely. So it's really exciting.
As obesity becomes more prevalent in our society, we are seeing more and more cancer patients who have a higher weight. And in order to make sure all our patients get the best possible treatment, we need to understand how different body composition and makeup affect the way patients experience cancer treatments and how they respond to cancer treatments.
Body mass index is favoured by epidemiologists and those doing population studies because it's easy to measure. The problem with it is that it doesn't tell us everything we want to know about body composition. And it's these, what we call host effects, that's the body composition, the lifestyle, and factors such as this, together with the genetics of the host and also the genetics of the tumour, that will ultimately determine how that cancer develops and how that process may influence how the body responds to treatment.
Medicine is increasingly becoming personalised. By that we mean we tailor our treatments and management of the individual patient to the exact details of that patient. That includes both the patient's wishes, what they would like and what they see as being important and not important, and also their various medical conditions and aspects, but also in terms of our research, their body composition, their fitness and health, and trying to tailor their treatments to exactly what is best for that individual patient.
By working together with colleagues across the UK, we can actually put the equipment into their routine clinical setting, and by that way we can generate the evidence as we go through. So effectively we're going at 7 times the pace.
The CANDO team has also established a really impressive research infrastructure, partnering with 7 other NHS hospitals across the UK.
So the real aim of this programme of research is so that we can understand exactly how different body composition patterns influence treatment outcomes, and therefore we can really personalise cancer treatment for the patient sat in front of us.
What we're trying to do is maximise the effectiveness of that therapy whilst minimising the harm.
World Cancer Research Fund has been funding innovative proposals, impacting global healthcare policies, and informing the public and healthcare professionals since 1982. Together, we aim to fulfill our vision and live in a world where no one dies of a preventable cancer.
So personally, I have worked with World Cancer Research Fund for many years as a member of their expert grant panel, and I'm really excited to be continuing to work with them in the context of this programme grant.
The World Cancer Research Fund has given us a unique opportunity to start to develop research which directly addresses the care and the needs of patients. It's enabling us to do studies which allow us to better determine who is at risk of problems during their chemotherapy or their immunotherapy in their treatment of breast cancer.
This research is really important because 4 out of 10 cancers are preventable, and we know that women in the UK, or the majority of us, are overweight, some are obese, and it's really important to know how your body weight and the composition, your fat versus your muscle, affects your chances of getting breast cancer.
We'd like to say a very special thank you to those who've supported this programme of work. Without your support, we wouldn't have been able to construct this activity in a way that's going to make a difference to the lives of people with breast cancer.